By the way, unplanned was extremely accurate and did not overstate anything. It's my professional opinion as an abortionist, as a former abortionist, that the Roe Act will harm women and their babies by removing important safeguards present in current Massachusetts law. I've been an advocate for women and their health issues my entire career. I was the co-founder and co-director of the First Rate Treatment Center in Jacksonville, and I was formerly employed as a medical director for Planned Parenthood of Jacksonville. I'm a fellow of ACOG and an associate scholar with the Charlotte Lozier Institute. I've done first trimester D&C with suction abortions and second trimester dismemberment abortions. I have had an abortion, and I have a cousin who's actually survived an abortion. This act would exempt abortionists and their clinics from the oversight required of all other medical providers and put total control in the hands of those who have a financial incentive to skimp on safety measures. I recently met a former manager of a Planned Parenthood clinic who confided in me that when their sterilization equipment broke down, she was told to just wash the instruments with dish detergent until it could be fixed. The Roe Act expands the definition of health, allowing abortion basically for any reason up until birth. Current Massachusetts law considers the legitimate needs of both mother and baby. With the Roe Act, there will be no requirement to preserve the life of the baby, even at term, nor any requirement to prevent fetal pain, which we know is real. Oh, sorry. Closer? Okay. If the baby survives abortion, the abortionist can simply do nothing and allow the baby to die. This is wrong. This is infanticide, and it is occurring. I will never forget one woman who came to my office complaining of prolonged bleeding and severe psychological problems after an elective medical abortion at 20+ weeks. After a grueling 2 days, she was told to sit on the toilet and push. She delivered a baby boy into the toilet who then drowned. To make matters worse, she had a younger brother who had drowned as a young child. The emergencies that occur during a late-term abortion, like profuse bleeding or injury to the internal organs, can quickly lead to death if not managed properly and quickly. It's imperative that late-term abortions be done in a hospital with full resuscitation